The following portion of Daytime is sponsored by Tampa General Hospital.
Tampa General Hospital has recently been recognized as a center of excellence by the Hypertrophic Cardiomyopathy Association, placing it among an elite group of hospitals nationwide and making it one of only 4 centers in Florida and the only one on the west coast of Florida to achieve this distinction. Joining us now is Dr. Robby Wu. He is Director of Hypertrophic Cardiomyopathy at the TGH Heart and Vascular Institute. Welcome, Doctor, and congratulations.
Thank you so much for having me. Thank you.
It's a pleasure to have you here. First of all, tell us, what is hypertrophic cardiomyopathy, and I hope I'm saying that correctly.
Yeah, we can call it HCM for short because hypertrophic cardiomyopathy is a mouthful to say.
Let's do that.
So in medicine, a cardiomyopathy is a disease of the heart, and hypertrophy means thickening. So HCM is just a disease of the heart where the walls are too thick. And the job of the heart is to fill with blood and then pump it out through the rest of the body. And so in HCM, the walls are too thick, which can sometimes impede the body's ability to perform that job. It's really under-recognized and a really underdiagnosed condition, but it's really, really common.
So how will that manifest? What are some signs and symptoms that people should look for HCM?
Yeah, HCM is really unique in that it presents a little differently in everybody. And that's one of the reasons why it's so underdiagnosed and so, under-recognized. For most people, they describe shortness of breath. And whether it's when they're exercising or when they're climbing up a flight of stairs, or even if they're just trying to exert themselves a little bit, they feel that shortness of breath. And then other people can feel chest pain. Some people even pass out because of their hypertrophic cardiomyopathy. Very concerningly, it is one of the most common causes of sudden death in young athletes. So when you see young basketball players dying on the court or young baseball players dying on the field in either middle school, high school, or even collegiate sports, it's usually because of thick heart disease.
Wow.
And that unfortunately can be one of the initial presenting symptoms in somebody with HCM.
So besides potentially young athletes, which I didn't realize, who does this condition affect?
Yeah, so this is a disease that affects everybody. And so it's a disease that affects anyone without any predilection for age, race, gender, ethnicity. It's been described on over 120 countries on planet Earth. And so we think that the prevalence is about 1 in 500 people, but it's so underdiagnosed and so underrecognized that it's probably a little more than that, probably 1 in 200. And there's also a really strong family disposition as well too. So in about half of patients that we see with HCM, there's a genetic mutation that's causing it. So it is a disease that we see across families and across generations.
What about treatment? What options exist?
So that's a layered question because as you can see, there are a lot of areas to navigate with this. For signs and symptoms of HCM, there are medicines that we use to treat it. So beta blockers and calcium channel blockers are medicines that we've been using for decades to treat HCM. More recently, there are now new medications called cardiac myosin inhibitors. So mavacamten or Camzyos is a new medication that's really revolutionized how we manage patients with HCM, and it can really make them feel better as well too. And then if patients don't respond to medical therapy, there's always, they can do procedures such as alcohol septal ablations or even operations such as surgical myectomy.
Tell us a little bit more, if you will, about that HCMA designation that I mentioned when I was introducing you and how that translates to patients who go to TGH and USF Health for treatment.
Yeah, so I hope you can appreciate that HCM is such a diverse and multifaceted and complex disease process. So we really recommend that patients who have the disease seek care in a dedicated multidisciplinary HCM center. And so the HCMA is the Hypertrophic Cardiomyopathy Association. It's a nonprofit patient advocacy organization. And number one, they're a great resource to have for patients with HCM. They offer a lot of information. And they also evaluate centers that manage patients with HCM. And I'm really proud to announce that we did recently receive our Center of Excellence designation earlier this year. And we're really excited to partner with the HCMA. And I think it just highlights that the dedication and commitment we have to providing world-class care to our patients with HCM.
The best right in our backyard. Dr. Wu, thank you.
Thank you so much for having me.
Happy holidays to you. And for more information, go to tgh.org/heart. We'll be right back.
The preceding portion of Daytime was sponsored by Tampa General Hospital.